الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. African trypanosomiasis, African sleeping sickness by Professor Mahmoud Hani Sulaiman. Definition: Human African trypanosomiasis, HAT, also known as sleeping sickness, is caused by two protozoan parasites. First, Trypanosoma brucei gambiense in the West Africa. Second, Trypanosoma brucei rhodesiense, East Africa. One in the West, Gambiense, and one in the East, Rhodesiense. Comparison of West African and East African Trypanosoma. West African, the organism is Gambiense, vector tsetse flies, palpalis group, primary reservoir humans, human illness chronic late CNS disease, duration of illness months to years, lymphadenopathy prominent, parasitemia low, epidemiology rural population. East African Rhodesiense يبقى organism Rhodesiense, vector tsetse fly but morsitans group, primary reservoir antelope and cattle, not human, antelope and cattle. Human illness acute early CNS disease, central nervous disease. Duration of illness less than 9 months. Lymphadenopathy minimal. Parasitemia high. Affect tourists in game parks, workers in wild areas, so it is occupation. Rural population. Epidemiology. HAT occurs only in sub-Saharan Africa, where endemic foci found in about 24 equal 24 countries. Coming map will show this. HAT a less problem today than past. Only 2,184 cases reported to WHO in 2016. This number reflects underreporting, but control efforts in endemic countries in past 25 years achieved success. Each year in industrial countries, HAT diagnosed in persons who travel to endemic areas. But given large numbers of persons who make such trips, incidence of such cases is extremely low. So many people go, but many of them come without having the disease. Thanks God. This map shows that to the west, T. brucei gambiense, to the west, this. And to the east, T. brucei rhodesiense, this. You see, vertical lines. Microbiology. Trypanosoma HAT transmitted in mammalian hosts by tsetse flies. Flies infected on taking blood from infected mammal. Developmental cycle in flies, then infective parasites migrate to salivary glands and injected into new host on taking new blood meals. In mammalian hosts, African trypanosoma found primarily in blood and to lesser extent in perivascular areas of brain and other tissues. In contrast to Trypanosoma cruzi, parasite causing Chagas, which is the parasite causing Chagas disease, African Trypanosoma do not have an intracellular phase. They avoid immune destruction by antibodies by periodically changing their glycoprotein codes through molecular process called antigenic variation. This picture shows Trypanosoma brucei rhodesiense trypomastigotes in rat blood. The arrow indicates it. The parasite indicated by the arrow is typical of the long, slender forms capable of multiplying in the mammalian host. The other two organisms represent this and this. The stumpy, non-dividing forms effective for the insect vector. Life cycle. During blood meal from mammalian host, an infected tsetse fly, genus Glossina, injects metacyclic tryptomastigotes into skin tissue. Parasites enter lymphatic system and pass blood into one. Inside host, they transform into blood trypomastigotes 2 and carried to other sites in body, reach other body fluids, e.g. lymph, spinal fluid, and continue replication by binary fission. 3. The entire life cycle of African trypanosome is represented by extracellular stages. Tsetse fly infected with blood trypomastigotes on taking blood meal on an infected mammalian host. 4 and 5. In flies midgut, parasites transform into procyclic trypomastigotes, multiply by binary fission. 6. Leave midgut and transform into epimastigotes. 7. Epimastigotes reach flies' salivary glands and multiply by binary fission. 8. Cycle in fly takes 3 weeks. Humans are the main reservoir of Trypanosoma borsii gambiense, but this species can also be found in animals. Wild game animals are the main reservoir of T. borsii rhodesiense. This will be in the coming slide. This is one tsetse fly takes a blood meal. This is 2 injected metacyclic trypomastigotes transform into bloodstream trypomastigotes which are carried to other sites. 3. Trypomastigotes multiply by binary fission in various body fluids, e.g. blood, lymph, and spinal fluid. 4. Trypomastigotes in blood. This is the diagnostic stage. 5. tsetse flies take a blood meal. 6. Bloodstream trypomastigotes transform into procyclic trypomastigotes in tsetse flies midgut. Procyclic trypomastigotes multiply by binary fission. 7. Procyclic trypomastigotes leave the midgut and transform into amastigotes. 8. Epimastigotes multiply in salivary gland. They transform into metacyclic trypomastigotes, and the cycle is gone again when the tsetse fly take a blood meal. Clinically, 2 stages. First is hemolymphatic, second is neurologic. First is hemolymphatic stage, where parasite multiplies in subcutaneous tissue, lymph, and the blood. Once parasite cross blood-brain barrier and infects CNS, disease enters neurologic stage. The primary difference be clinical patterns of gambiense and rhodesiense HAT is that the latter follows much more rapid course and can lead to death in months, whereas gambiense HAT typically develops chronic pattern that can last for years. Untreated HAT almost inevitably ends in death. It is important for caregivers attending to travelers with fever and other non-specific symptoms who have been in endemic areas to include HAT in differential diagnosis. Again, it is important for caregivers attending to travelers with fever and other non-specific symptoms who have been in endemic areas to include HAT in differential diagnosis. Therapy treatment is complicated because it varies according to clinical stage of the disease and the trypanosome subspecies causing the infection. Toxicity of the drug used to treat HAT is a major problem. These are drugs recommended for treatment of the African trypanosome. If the causative agent is gambiense, pentamidine, alternative soramine. If the stage is 1, if the stage is 2, eflornithine, alternative eflornithine with nifurtimox, melarsporol. For the organism rhodesiense, in clinical stage 1, soramine. In clinical stage 2, melarsoprol. Prevention. Trypanosoma is complex public health problem and episodic problem in many developing countries in Africa. Control that focus on eradication. The control focus on eradication of vectors and drug treatment of infected people is operation in most endemic regions for decades. Enormous progress made, so vision for elimination of HAT by 2020 developed. Individuals can decrease the risk of acquiring infections with trypanosome by avoiding areas known to harbor infected insects, wearing clothing that decrease biting of flies, and using insect repellent. Chemoprophylaxis is not recommended due to high toxicity of drugs that are active against active African trypanosome and no vaccine is available. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.